Have you ever wondered how far your government would go to lie to you and manipulate public opinion in order to pass legislation that would be destructive to society? If you live in Ontario, you need to be aware that Dalton McGuinty and his Liberals are trying to implement a plan in May that will destroy a key component of the healthcare system, that will increase the burden on other healthcare practitioners, that will increase wait times in emergency rooms and doctors' offices, and have Ontario citizens paying more out of pocket as the standard of care crumbles. So what am I referring to exactly? My name is Lara, and I'm a pharmacist who graduated from the University of Toronto. My parents were the ones that told me to go into pharmacy, to work hard now so that I would enter a reputable and stable profession, so that I wouldn't have to suffer in my life the way that they did. After many years of hard work, I graduated at the top of my class, was awarded 2 medals and several scholarships for my academic achievement. Since then, I've worked in over 100 pharmacies all over Ontario. In the beginning, I had 2 permanent positions. One was with the Shoppers Drug Mart, and the other one was at a small, family-run independent pharmacy, namely my father's independent pharmacy. What Dalton McGuinty is telling you is that he's going to lower the cost of generic drugs by removing so-called kickbacks that generic companies pay to pharmacies. In fact, these are professional allowances that make up the gap between what the government pays us to fill a prescription and what it actually costs to fill a prescription. In the last 20 years, the professional fee that the government has paid us has increased by 56 cents. How did pharmacies survive this? It was because of the professional allowances, and the government was quite happy to let these generic companies fund and compensate pharmacies for their services so that they wouldn't have to. Now they're saying they're going to take away these professional allowances. They're lying to you when they say this is a battle against big pharmacy. I'm here to tell you that it's not. The ones that will suffer are the small, independent family pharmacies that are based on pharmacy as a profession. They don't base their business on the fact that you're going to buy chocolates or cosmetics or appliances or groceries or cameras or anything else on the way out. You see, those big stores, they will survive because they can make profit on other items. If pharmacy as a profession can't survive, if we can't survive providing our services, then there's something wrong. Would you expect your dentist or your doctor to depend on you buying something like chocolate on the way out of the office so that they could pay their bills? I don't think so. What is more alarming is some of the comments made by the Minister of Health, Deb Matthews, who should know better. She says that she would be willing to compensate pharmacy owners for providing professional services such as flu shots. Does Deb Matthews know what the scope of practice is for a pharmacist? In all of my training, I've never been trained to give any type of vaccine. In fact, it's in the scope of practice of nurses and doctors. So what she's saying is that instead of paying a pharmacist for what we're trained for, she would pay us pennies to take away the jobs of other healthcare practitioners, to take away the jobs of nurses and doctors who are actually trained to give vaccines. Deb Matthews, what's next? Am I going to be filling cavities? You're going to pay me a couple of dollars for that? Other alarming comments made by the minister. If they are taking pressure off our family doctors, if they're taking pressure off emergency departments, we want to compensate them for that. There is no if in this. I do that every time I am in a pharmacy. Deb Matthews, I ask that you come join me in a pharmacy on my entire shift, 2 days in a row. Let's do 2 16-hour shifts together. You don't get to eat, you don't get to sit if I don't get to. And believe me, I don't get to. You will see how many patients I've stopped from having to go to the doctor's office or emerge. You will see how many times I have to contact doctors about changes or stop the dispensing of medication due to a severe allergy that nobody else caught but me. But that's my job. You will see how many times I did not get paid for what I did. To the public, if you want the standard of care in Ontario, to go down. Then you can support the government. But if you want your senior citizens, your chronically ill patients, your children to have access to a healthcare practitioner, then you will say no to the government. You will ask that the government starts talking to healthcare professionals before they try to make a devastating move. What about all the pharmacy students, the ones that have been trained and have been paying for their education for the last few years? How are they going to do their internships? I was lucky enough that Shoppers Drug Mart paid me for a 3-month internship, even though they were the ones teaching me. I had an amazing preceptor pharmacist, and I learned so much from her. She's the one that helped me transition from school and putting all the knowledge I had into practice. Those will disappear. In fact, a lot of pharmacy students now find themselves with no job and no internship in the summer. Say no to the government. Tell them to do some research before they decide to destroy a society. Go to stopcuts.ca and find out the real truth about what Dalton McGuinty is trying to do to you.